We decided that there was a great need out there for education for practice nurses in this area, and we're not just looking at infant care but also care of the mothers in the first 12 months after giving birth, because we think there's a lot of women out there that the care gets missed. They don't know that they need to go to their GP or practice nurse to be seen, or if they do, they only come in when they really need to rather than coming in regularly for checks. So we know that postnatal care is best presented in primary health care, and the current model that we've got is not really working that well. So that's why we came up with this little education program. So it was just a pilot project that we ran, but it was based on some of the material from the World Health Organization, and these are recommendations. They have 12 recommendations that they brought out in 2013 for antenatal intrapartum care. And these are the areas that I thought, and the rest of the team thought, that practice nurses could have some influence on. So assessment of the mother postnatally, so in quite a few areas, not just breastfeeding, but checks. And also I know there's a lot of interest in domestic violence at the moment out there, so checking on their relationships that they're having with their partners, those sorts of things. Counselling, so counselling in all areas, so we were just not looking at psychosocial health, which is down the bottom, but all sorts of areas like nutrition advice, etc. And then the psychosocial support that the mother needs. I think, well, I shouldn't assume that every woman is a mother, because it took me a long time to become a mother, and my little girl's adopted, so I didn't have a pregnancy like most women do. But we know that a lot of psychosocial support is required after giving birth and for new mums, so we thought this is a big area as well. So we developed up this feasibility study, and we decided we had ideas of what we wanted to give in the education program, but we weren't sure what the practice nurses actually wanted to learn. So we designed a pre-intervention survey. We had some other practice nurses look at it to see if they thought the survey would work with the nurses that we sent it out to. So they completed that. Then we conducted a 2-day educational program. We got a written evaluation of the program when it finished, and then we asked the practice nurses to write in some reflective journals. After they had a postnatal visit with mums and babies. Now, I don't know who likes reflective journals, but I'm not a massive fan of them. And we wondered whether they would work or not, but interestingly enough, we did get the practice nurses to fill them out, because they could actually see their progress by writing down and reflecting on each visit with a mother and baby, how they were progressing with the care that they were providing. So, as I said, Wendy was based in Toowoomba, so she went around to 4 general practices in Toowoomba and tried to recruit practice nurses that might be interested in coming to this education program. We wanted to limit it to around 12 participants, because it was just a little pilot project. We didn't have much money, so we were a bit limited on funding and how much we could spend. And each practice was invited to nominate 4 to 6 practice nurses. In the end, we got about 20 practice nurses that wanted to come to the education event, so we went a little bit over to start with. With the survey, with the pre-intervention survey, that just collected the usual things like demographic details, how long had they been a nurse for, how long had been a practice nurse, what age, qualifications, had they had any involvement in postnatal consultations, and we asked them to self-assess on their competence and confidence with the provision of infant and maternal care. So how did they feel when they were actually seeing a woman or an infant coming in to the practice? And then we asked some open-ended questions as well. I'm giving a presentation on this on Saturday morning, and I'll provide more information on that then. So this is sort of some of the questions from, I just put some of these in here so you could have a look at it. Ask them whether they'd undertaken these skills, did they feel unskilled in it, did they feel they needed assistance, or did they feel that they were proficient? So, antenatal care, routine infant checks, etc., that you can see there. And then going on more to, infant sleeping behaviours, infant crying, because we know that that's a lot of the issues that mums have problems with, sometimes related to, our first world problems that we think a baby should sleep through the night, and you've probably been learning about all that sort of stuff. Even simple things like teething, giving advice on that. So the nurses filled out this, we got it back, and then we tried to work out from that what we would include in the education program. So then going on from that, we developed the education program. So Wendy, the GP, Fiona, myself, Helen Goodwin, who was the midwifery lecturer, and Rebecca Farley, who his name's not on there, she was another GP, a young GP working in Inala. Those from Queensland will know that area, and had a lot of experience dealing with infants and babies. So we all developed the program together and then delivered the program together. So we developed it from our knowledge, what we got back from the practice nurse survey, from literature that we found, and then went on to include these topics that you can see there. So a big one, which I think most nurses are fairly good at, is communication, but we started off with something like that because some of these subjects are quite difficult to talk about when we're talking about sensitive issues like sexual relationships with your husband and domestic violence and all those sorts of things. We thought it would be good to revise some of that. We also spoke about reflective practice because we wanted the nurses to fill out the reflective practice journals afterwards. Some of the education, we gave the practice nurses some information before they came to the education session, because at the University of Queensland we use problem-based learning where you have scenarios, case studies, and you come in as a group and work through the case study. I call them like home and away stories. There's always a disaster happening, something like that. So we gave the practice nurses these case studies so we could do some group work in the session. So they're quite interactive sessions. Anyway, you can see the subjects there that we spoke about and the different types of teaching styles, because there's nothing worse than sitting for 2 days and just being spoken to and, death by PowerPoint. So we used case studies, we did some problem-based learning sessions and, facilitated some small group discussions. There was actually lots of discussion, a lot more discussion within the 2 days than we thought there would be. And we used some role plays for the communication stuff. So that's the actual content that we covered over the 2 days, just so you get a bit of an idea of what we did. So quite a few topics there. The breastfeeding one did take up a couple of hours because that's always an interesting one, I think. And then I've just thrown a couple of slides. I thought we'd have a bit of a laugh halfway through. Yeah, some of the slides that we had in our presentation. So, talking about asking sensitive questions, how do we go about doing this sort of stuff? Because it's sometimes not that easy. Motivational interviewing, which I know you probably hear lots about because we use that for all our chronic diseases and, when we're discussing issues with our patients. We also included lots of research in it because we're all, university lecturers and we like research. We wanted to present a lot of the latest research to the practice nurses so they could get an idea. I mean, even though that reference says 2005, it's a bit old. We wanted to present some of this information to the practice nurses because we know it's hard to keep up to date with this stuff. When you're busy working in clinical practice, there's so much stuff coming out, it's really difficult to stay on top of it all. Are you going to say something, Anne?
No, I just sort of recognised your name there.
Yeah, okay. And then Wendy gave a very long and lengthy presentation about breastfeeding and, went through all the scientific sides of it. This is actually from a PhD study, I think one of her students. And then these are some of the cases that we presented. So we had lots of different cases to allow us to discuss issues that you might come across, with your patients coming in. So the post-intervention measures, as I mentioned, were this reflective journal, which everyone cringes when they hear that. So we gave one of those to each participant, but we had an incentive, and they were doing this just before Christmas. $100 Myer gift voucher. We were smart. You know, we had ethical approval to do this. No, we did. No joke, we did. So we asked the practice nurses to, you know, record in there what they were actually doing, what the visits were that they were dealing with whether it was with an infant or whether it was with a mother. And then we used the 5 R's of reflection. That's what it looks like. I'm not sure if you've seen the 5 R's of reflection, but we use this a lot with our nursing students these days. You know, asking them to provide a description of what actually occurred. Then, you know, how did they feel? What were their emotional responses? Did that influence how they behaved when they were dealing with the patient? Then, you know, relating that and reporting your understanding of that. Reasoning, exploring and explaining the situation, and then reconstructing. So then what would you do next time? You know, are there things that you'd possibly do better next time? Would you change anything or not change anything? And that was the checklist. So they would check off what they actually did in the consultation with the mother and the baby. So you can see there, is this working on there? No, I don't think it's. You can see there's the infant list and the mother's list. So quite a long list. So then the demographics, even though we only had a small sample size, we did collect demographics of the participants just to try and work out if they were similar demographics to the Australian practice nurse population. And they were basically, even though there was a small number, you can see there. We had some young practice nurses. There were some new graduate practice nurses in one of the practices. And as per normal, the average age of the nurses, you know, we've got the 50-year-olds, we're all in that age group. So, and then, you know, the hours they worked at the practice, because we know that there's a lot of part-time work in practice nursing, so we looked at that as well. How am I going for time? Trying to speed through it? Yeah, okay. So then we also looked at experience as a registered nurse and experience as a practice nurse, and then experience at current practice. So we collected the same sort of data that's always collected with the Practice Nurse Australian Workforce surveys that are done every few years, though I don't think one's been done for a couple of years, but is it? Not sure. Sorry?
Every year APNA does.
Yeah. Not the big ADGP ones that used to get done, but anyway, yeah. Okay, so this is I put this in just so you could see my little iPhone photos of one of the practice nurses filling out the journal. So this was a little baby girl coming in for a 6-week check, and the mum came for her check with the doctor, with the GP. So the practice nurse that she was able to give advice with confidence, and that the more consults that she did, using her new skills, the more information she can get across. So as she was becoming confident with what we discussed in the education program, and even I think it was just making the practice nurses think a bit more about these consultations and what sort of information they could provide, possibly information that they've known about, that they've learnt years ago, but not thought about that they could do in the consultation. So this one was a little 12-month-old that was coming in for immunisations, but look at what the nurse actually ended up doing. So these were all the things that she ticked. So, you know, we know that this is what happens in practice nursing. Patients or infants, children, whoever, come in for something, and then we end up doing a whole lot of other things. So the baby came in for immunisations, but this is, in the end, was what she ended up doing and discussing. So not just the infant, but with the mother. And yeah, she's just written, a 12-month-old boy came in for immunisation. The mum was well, and they felt confident giving advice, using both personal experiences and professional to reassure the mum. And sometimes we do rely a little bit on our personal experiences, but we need to be a bit careful with that. So the outcomes were that the PNs who participated were overwhelmingly positive in their evaluation of the education program, and they identified increased competence and confidence when they were caring for mothers and infants in the first postnatal year. And, you know, it was a feasibility study. It was just a small study, but we used a adult learning approach so that we knew that the people that were coming, the practice nurses that were coming to the sessions, were keen to learn this information. We actually ended up with one female GP attending as well, and we realised afterwards that this education program would probably be better suited to have for practice nurses and GPs combined, that it shouldn't just be for practice nurses. Because definitely the female GP that was there said, you know, there's lots of GPs that don't know this stuff and they should be coming to the education programs as well. So that's what we came to the conclusion of, that both GPs and nurses, you know, should be involved in coming to these sessions, and maybe we could formulate some sort of interprofessional education program. And Wendy, there's a comment down there from Wendy and Jeff Mitchell, another GP up in Queensland, and that it relates that many practice nurses rely on personal experience or the guidance from their supervising GP, and in brackets, who may not have the requisite knowledge to develop the necessary skills to undertake consultations. So I think that's probably quite true. And I've beat my 5-minute warning. So yeah, that's just a brief overview of what we did in that project. So I'll just tell you, we also got the mums to fill out surveys as well, before and after. So I was just talking about the practice nurse side of it here. So that when we got the mums to fill out the surveys, we actually realised there's a whole lot of stuff that's getting missed. So there's stuff that's getting doubled up on, so both GPs and practice nurses are doing it, and then there's a whole lot of stuff that mothers and babies, infants are not being seen, or, you know, issues that are not being discussed with. Even simple things, you know, like PV discharge post-delivery, that sort of stuff. So, yeah. Contraception, you know, simple things that should be, although contraception I think gets picked up fairly well, but yeah, there were lots of things that were being missed.